So I want to introduce our next speaker for tonight. Okay, and I don't get to do this off email very often, so here we go. All right, so, no, I don't need that, thanks. I got it, okay. Let's see, it's all the eyes, the aging. Okay, Dr. Scott Sherr is a board-certified internal medicine physician with additional certification in hyperbaric oxygen therapy. In addition, Dr. Sherr is the Chief Operating Officer of Health Optimization Medicine and Practice, USA, an online certification program for doctors and healthcare practitioners with a mission to truly move the needle on health. Dr. Sherr operates integrative HBOT.com, his own virtual hyperbaric consultation practice, and performs in-person consultations in the San Francisco Bay Area. He also consults with clinics and patients around the globe. So please welcome Dr. Sherr.
Thank you. That was a biohacked bio for you right there. Thank you very much. Everybody can hear me okay? Okay, I'm mic'd, cool. He was right, it just turns on, very nice. So Harry, that was an awesome talk. Thank you so much for presenting. I'm gonna be talking about hyperbaric oxygen therapy today. Has anybody heard of hyperbaric oxygen therapy? Oh wow, awesome. Was anybody here 5 years ago when I presented on hyperbaric therapy? So it was my first talk on hyperbaric oxygen therapy, really, was actually at this location. And most of you probably know that the Silicon Valley Health Institute has a YouTube channel. And I'm not very proud of that talk. It was my first one. I was just learning how to present on this topic, but it's been viewed 40,000 times. Yeah, and I'm just really happy to be here with you all today to redeem myself, I hope. The first comment on YouTube was, great material, terrible speaker. I was like, okay, I can do better, I promise. So I hope I do better today. And I really hope that I give you all just an understanding of how powerful this technology is and how it's really not just about the technology itself, but it's what's happening at the physiological level, what's happening at the cellular level. That's really what's most important. So my story starts a little bit before this, but this is where I trained my medical career. Unlike Harry, I did the regular medical doctor thing. My father, though, was a chiropractor, and so I grew up very alternatively. I didn't know what a box was, you know, the box of conventional medicine. I don't think I even saw a doctor until I was 14 or 15 years old. But I did see that he had limitations as to what he could do. And as a result of that, I decided to go to medical school with this high-minded idea, 21-year-old idea. I'm going to change the world. I'm going to bring this conventional world together to this alternative world. I'm going to bridge this chasm, this large chasm. There was no such thing as functional medicine. That wasn't even a word. Integrative medicine wasn't a word. My father's office was a wellness clinic. Now that word's been around a while. It's been slightly bastardized over the years. I think you all would agree. But I went to medical school, and I went to this one particular location called the Shock Trauma Center in Baltimore. Has anybody been to Baltimore before? All right, has anybody been shot in Baltimore? I hope not. No, okay. So part of my rotation as a second-year medical student was to round at this place, the Shock Trauma Center. Downstairs in the basement was this gigantic submarine-looking thing, and I had no idea what it was. But I saw a couple patients come in with carbon monoxide poisoning and something called flesh-eating bacteria or necrotizing fasciitis. Has anybody seen terrible pictures of that? I know Marcy knows what I'm talking about back there. She's a nurse at the hospital I work at locally. Hi, Marcy. Okay. All right. So I was at this facility, and I saw patients go into this chamber, sometimes on respirators, and walk out after being on a respirator. And I was just blown away. What is happening in this chamber? So I asked some of the technicians, some of the doctors, and they just told me it was oxygen under pressure. And I thought about it for a little while. I'm like, you mean it's just oxygen? I'm like, oh yeah, that's all we really need, isn't it? Most of the time. More oxygen at the cellular level. And it all starts with oxygen. Without oxygen, we don't have much time, do we, before we die? And I saw when you just accelerated the amount of oxygen in the body, what it could potentially do in very quick order for some of these patients. So I dove into the literature, and I realized that there was tons of work that had been done in this country and in other countries around the world on what hyperbaric therapy could do. And I want to start with this slide because it's really the crux of what I'm going to be talking about today. This is what hyperbaric therapy does. It heals wounds from the inside out, okay? It heals wounds at the cellular level, and it's doing this in 4 major ways. It's reversing hypoxia, so low oxygen states. It's decreasing inflammation, fighting infection, killing bugs, and causing an exponential release of something we just heard a ton about, stem cells. These are our own stem cells from the bone marrow, and stem cells from the neurologic tissue as well. So the neurons and the neuron supporting tissue has stem cells in there that can get released and migrate to areas of injury. In fact, I use combinations of both exogenous stem cells outside the body and the endogenous supply that we release with hyperbaric therapy together, which we'll talk about too. Is that I'm an integrative guy at heart. And so, as a regular doctor, I have to give you objectives to what I'm talking about today. And it's going to be relatively quick order, just to give you an idea of what we're doing and because really the power of hyperbaric therapy is I think is very intuitive once you understand what it's doing. And so, has anybody scuba dived before? Couple people? Has anybody been in a pool before? Okay, everybody, right? So whenever you're underwater, all that water above you is going to be exerting a pressure on your body. But you don't really feel it because you're weightless in it, but it's actually quite heavy if you pick up a bucket of water. So we're modulating that pressure in a chamber. We're giving you 100% oxygen, typically. So does anybody know how much oxygen is in the air we're breathing now? Any guesses? 21%. All right, I thought I heard 41, but 21%. It used to be more, actually, on the Earth's surface, but now 21%. And we increase that oxygen level to 100%. You breathe that oxygen intermittently under pressure, so usually between 60 and 120 minutes, an hour to 2 hours at a time. And so some of the terminology, just so you know, is 2 ATA, 33 feet of seawater, 3 ATA is 66 feet of seawater. So we're simulating the pressure that you would feel underwater, giving you more oxygen at the same time, and then doing an intermittent exposure, usually 1 to 2 hours on a daily basis for a period of time. Does anybody know this bridge? Shout it out. All right. No Sleep Till Brooklyn, right? So, anybody a Beastie Boy fan? Is that, I don't know. Okay, all right, anyway. So that's me. That's my age. But the Brooklyn Bridge is where something called the bends was first described. And the bends was when people came up too fast from building these bridges, from underneath the water, they get these terrible symptoms, neurologic seizures, or neurologic symptoms like seizures. They would die. They would get paralyzed. But they realized if you went back inside these chambers that were underneath the water, those symptoms, if you weren't dead already, would get better. And so they decided to make chambers that simulated that pressure. This is the first type of chamber that was developed. It's called a multi-place chamber. Multiple people getting treated all at the same time. These chambers are hard steel chambers. They go down to very deep, deep depths to simulate the pressure you would be if you were making a bridge or building a tunnel, for example, underneath the ground. This particular chamber is at the Segal Center for Hyperbaric Medicine in Tel Aviv, which I visited in February of this year. This is a modern multi-place chamber. This is the largest hyperbaric facility in the world. They're treating over 200 patients a day in their chambers, and they're actually increasing their capacity to 500 patients a day by the end of 2019, with a 20,000 person waiting list for their reverse aging program, actually, which is their program that looking at reverse aging as their showcase. And this underlying physiology that we talked about, which we're going to go into more, is the reason why it all works. So I have a special guest today. Whenever I ask or tell people that I practice hyperbaric medicine, they often ask me, is it this guy? Isn't that what this guy used? My favorite Michael Jackson song. Does anybody moonwalk? Anybody? No? So Michael Jackson popularized monoplace chambers, which is the second type of chamber, because he used one for actually third-degree burns that he had on his head after a Pepsi commercial back in the 1980s. Does anybody remember that? So he donated the chamber he used to a local children's hospital afterwards in Los Angeles. Whether he used it to sleep in, whether he did it for other crazy things, nobody knows. But I can say he did use it initially for third-degree burns. So I'm thankful for Michael Jackson because I get to play that song, number one. And it's my favorite Michael Jackson song. And number two is that I get to have the conversation about what hyperbaric medicine is, and it's a very easy access point for a very specific generation of people, but a lot of those people we're treating now in the chambers. Over here on the right-hand side of the screen, is a modern version of a monoplace chamber. All right, there you go. All right, so soft chambers or mild hyperbaric chambers go to less pressure. They typically have less oxygen. And these are only approved for one condition by insurance companies, and that's called acute mountain sickness. So that's, if you go up very high in altitude, you get sick, you can go into one of these and feel better. However, we do think that there's likely a role for these chambers, probably for more neurocognitive reasons. So they tend to give less pressure and less oxygen, and as a result of that, there might be a sweet spot there for the brain, for example. So they're doing some research on these types of chambers for brain-specific treatments. And we'll get into that a little bit later. So if any of you took a physiology class, we know that red blood cells are typically the type of cell that takes oxygen from the lungs when you breathe in and brings it to the rest of your body to allow you to utilize that oxygen at the cellular level. But most of us also have normal lungs. So 97% of the sites of those red blood cells are saturated with oxygen already. So, and that's, anybody's put a pulse ox on your finger, you know that's what it shows. So there's two ways to increase your oxygen carrying capacity. One is to increase the number of red blood cells you have in circulation. There's a legal way to do that. Does anybody know the legal way to do that? Go up in altitude, go up to mountains and train in the altitude. You can increase the number of red blood cells that way. And there's a number of illegal ways of doing it as well. Giving yourself red blood cells before a race, for example. So you've heard of Lance before. So doping, you can use a medication called Epogen, which actually increases the number of red blood cells in circulation. Or you can get into a hyperbaric chamber, because we increase oxygenation in a very different way. So you saw some tubes of blood before with Dr. Adelson's talk. So we are saturating the plasma of the blood in the chamber. So we're saturating any red blood cells, any sites that are actually available, we're saturating those. But then we're going into the plasma of the blood, and we're saturating that to a significant degree, more than you can in any other way. And that's the power of hyperbaric therapy in a nutshell, is saturating 1,200% more, 12 times more, up to, or even more than that, into the plasma itself. This is called Henry's law, if you like physics. The more gas under pressure, the more pressure of the gas. Let's try that again. The more pressure that gas has on it, the more of that is going to go from a gaseous form to a liquid form. I try to make that simple, but I think I complicated it. Sorry about that. All right. Anyway, so a simple example, normal tissue oxygen tension is about 55 millimeters of mercury. At 66 feet of seawater, you can increase that tissue oxygen tension to about 500. And there's been some elegant studies that were done in the 1950s exsanguinating animals, giving them plasma. At 3 ATA, you no longer need red blood cells to satisfy your physiologic needs. You can saturate so much oxygen into your body that you don't need red blood cells anymore. I don't recommend that. But it can be used as a life-saving maneuver. If somebody's had acute trauma, they're bleeding profusely, you can throw them in a hyperbaric chamber or place them gently. And also, if you're a Jehovah's Witness and you don't want a red blood cell transfusion, this is a temporizing technology, a temporizing potential. So that's what's happening. We're getting a bunch of oxygen in circulation. Now what happens? So immediately, there's the three things that are going to happen. You're going to have oxygen delivery. You're going to have oxidative stress. Oh no, oxidative stress. It's okay, I promise. We're going to talk more about it. I know everybody gets scared when you say the word oxidative and stress together, or even one of those words by themselves, really. But no need to fear, really. So the first thing that's going to happen is that your blood vessels are going to constrict. And Dr. Adelson actually made a comment about how when blood vessels are injured, they start leaking things into the tissue around them, causing an inflammatory reaction, release of a number of different things that make the tissue swell and maybe hypoxic or lack oxygen. So if you constrict those blood vessels, what's going to happen is that less of that stuff's going to come out, and that's a good thing. And actually, some of the studies that have been done on traumatic brain injury have looked at intracranial swelling, so intracerebral pressure. And one of the main ways hyperbaric therapy seems to work is by decreasing intracranial pressure very quickly, because it decreases that swelling. So very effective. But we're also increasing the amount of oxygen in circulation, right? So as a result of that, the net is you're still getting more oxygen to tissues. I have a pretty picture in a minute. So as you can imagine, if you have a blockage here and you have all this tissue over here that's dying or potentially going to die, if you have more oxygen in circulation, all of a sudden, a lot of that extra tissue may not have to die. It may get enough oxygen to survive an acute event. Has anybody heard at least as a doctor, we learned about, time is brain or time is heart for a heart attack or for a stroke. So what if you get into a hyperbaric chamber immediately or as soon as you can, and you prevent all that downstream tissue from dying behind that blockage? Because what we're doing, when you have all that oxygen in circulation, it's going to diffuse further outside of a blood vessel. So about 4 times further. So 4 times further on the microscopic level is extremely far. And so as a result of that, you're preventing a lot of tissue from that downstream effect, all those inflammatory cascades and that tissue dying potentially. So preserving tissue. This is spinal cord injuries, this is strokes, this is acute coronary syndrome or heart attacks, you name it. Acute traumatic ischemias of limbs. Some significant data coming out in the last several years to show that. It immediately decreases inflammation and pain. It causes an exponential release of stem cells. It improves the capacity of the body to heal and also to fight infection. And kills bugs. Everybody likes to kill bugs. Not just the bad ones, not the good ones, right? But anaerobic infections, especially those that don't like oxygen, and then facultative anaerobics infections with those just like a little bit of oxygen, but not a lot. And that's what hyperbaric therapy potentially can affect. Anybody heard of Lyme disease? Lyme disease is a facultative anaerobe. Yeah, anybody have heard of MRSA? Staph, also a facultative anaerobe. It also potentiates antibiotics. So this is a pretty picture of a blood vessel just showing a blockage, but you can see how oxygen is still getting further afield, further down the blood vessel because it's saturating the plasma itself and not just on the red blood cell, saving the tissue that might be downstream of a blockage. So what's happening over a protocol, though, is a little bit different. We have the oxygen that immediately got into the body, but now we have what's called epigenetic changes that are happening on the DNA. Has anybody heard of the word epigenetics or the field of epigenetics? So hyperbaric therapy has an effect on at least 8,000 genes at this point. And it causes either the expression or suppression of various genes. It expresses those that are more responsible for growth and decreasing inflammation. And it suppresses or downregulates the genes that are responsible for programmed cell death and for inflammation itself. But this is a protocol of hyperbaric therapy, not just one. At least 3, but maybe more depending on the indication. And we're going to be optimizing all stages of wound healing. These are all cells that are related to wound healing. These are connective tissue cells, bone cells, cartilage cells, all optimizing their maturation process and recreating the scaffolding of tissue that's been injured. There's an antioxidant response. So we talked about oxidative stress. And so that's always thought about as a bad thing, but actually oxidative stress is how our body actually signals and does a lot of the work it needs to do. But if it's out of control, that's a bad thing. Good thing is that our normal cells have this ability to have this reactive antioxidant response. And as a result of that, there is an equilibrium that occurs, except in patients that have chronic complex medical illness, which I'll talk about. Something to address. So there's stem cell release, activation, and migration to injury. We have a decreased inflammation. We prevent cells from dying. And we recreate new blood vessels. And again, just to piggyback on Dr. Adelson's talk, blood vessels are needed in tissue to allow that tissue to maintain its health. If you don't have blood vessels inside the tissue deteriorates. And hyperbaric therapy improves the blood vascularization. In the brain, we see it now on studies and imaging. In the heart, limbs, in various locations. So we know that hyperbaric therapy is a massive stimulator of new blood vessels forming, especially in areas where there's inflammation, especially when there's areas of degeneration. So here's a pretty picture of a blood vessel that's creating new blood vessels around a blockage. Has anybody heard of angina before? No. They're doing a study right now looking at how hyperbaric therapy may be able to actually collateralize or make new blood vessels form around stenotic blood vessels. Naturally, you don't have to have any stents, you don't have to have any procedures. It's pretty amazing stuff. So I like to think of hyperbaric therapy as a scaffold builder. You heard me say the word a little while ago. We're recreating the scaffolding of tissue from the inside out. New bone, new connective tissue, new stem cells that are making those types of cells, new blood vessels. And the protocols vary depending on the indication. If it's a more of an acute indication, a more of something that just happened, you need less treatment just to optimize your body's healing response. If it's been going on for a longer time, you need more. And the treatment regimens can be anywhere from 3 sessions to anywhere up to 120 or even more. And these sessions are done in succession. They're not done just once a week. They're usually done Monday through Friday, sometimes through Saturday with the weekends off for a protocol of time. And that's because of that epigenetic change that we're actually affecting on the DNA itself. It doesn't just take one treatment to do it. It's a successive amount that really does the trick. So this is where it gets fun. We talk about what hyperbaric therapy can do for all of us. And so, again, we talked about this, but just to reiterate, the basic physiology is the same, okay, no matter what we're looking to do in the chamber. We're reversing hypoxia, both immediately by infusing the body with oxygen, and we're recreating new blood vessels over the long term to sustain it. We're decreasing inflammation immediately, and in the long term, we're epigenetically changing the DNA to have these effects over the long term by decreasing some of those inflammatory cytokines and factors that I mentioned. We're killing bugs, and we're causing stem cells to be released, regenerating tissue from the inside out. Can you tell I get excited about this? This is the fun part. So, okay, all right, so hyperbaric therapy is FDA approved. Remember when I mentioned bridging that chasm before? This is why. I realized that there were 14 indications that were FDA approved that insurance would cover, which was fantastic. And I also found out they're vastly underutilized for these particular conditions, unfortunately. But that's my role. My role is to educate all of you and to educate the world and say this is a therapy that can work because of the physiology and what's happening, but we have data to support its use in delayed radiation injury. So if anybody's had cancer before, they may have had radiation to try to treat it. Unfortunately, radiation tends to cause injuries, maybe mild, maybe moderate, maybe severe. Hyperbaric therapy is probably the most effective treatment for radiation injury. I haven't tried stem cells yet, but maybe. But as far as I know, what the literature shows, one of the most effective for radiation injury. Diabetic foot ulcers, we're saving patients from amputations all the time. And I've had patients that have come to see me before that have had 3 amputations, and now we save them from the 4th, their 4th toe, and they ask me, well, why didn't somebody send me for the first 3? I don't have a good answer for them other than insurance and all those kinds of things. So chronic bone infections and some other indications as well. The ones I've sort of shaded in gray are the ones that are more acute, Michael Jackson's thermal burns, carbon monoxide poisoning, etc., but very effective for these conditions. Where there's a lot of excitement and where my practice really is grounded is in investigational hyperbaric therapy, things that are not covered by insurance yet, but there's lots of great data to support their use. But these are not conditions that often are treated just with hyperbaric therapy alone. They're usually treated in more of an integrative fashion, looking at various other technologies, other practitioners, a foundational approach to health to make sure that you really have long-standing improvements. And there's great data to support patients with, actually new data with acute stroke, patients with more chronic long-term stroke symptoms, reflex sympathetic dystrophy, inflammatory bowel disease, chronic fatigue, cancer synergy, so not a cancer treatment on its own, but along with other therapies can very much be a part of the healing and recovery and the regressive process of the cancer. Regenerative and anti-aging and combining with things like stem cells and PRP. Optimal performance, the fun stuff for people that don't have any problems, in quotes, right? And of course, dementia and mild cognitive impairment. That's also a hugely growing field in general, but in the hyperbaric world, a very, very important one, I think. Others as well, and each of these would take an hour as well to talk about, of course. But just to give you a sense of my approach, because what I've learned over the years, growing up as a kid and up until now, is that no one person has the answers. If they tell you they have all the answers, run, okay? Because it takes a collaborative of really multiple people, I believe, and multiple types of therapies and technologies to really get a good sense and really heal from the inside out. It's not just going to be hyperbaric therapy that's going to do it. And so I was approached by, who is now my mentor, a very, very brilliant doctor named Dr. Ted Achacoso, who pioneered a field called health optimization medicine in practice. And it was very simple. He said to me, Scott, I just want to move the needle on health by creating a foundation. I'm not going to worry about illness. Functional medicine doctors can do that. I'm not going to worry about disease or acute care. Conventional medicine can do just as good a job at that. What I want to do is create a foundation of cellular health, gut health, immune health, and then everything else will likely get better in the process. If it doesn't get better, there's still all those other doctors that can help out. So health optimization medicine in practice became my calling as my foundation. And that's actually going to be a foundation for anybody who wants it to be, because it's going to be an educational platform for doctors and practitioners to get certified in if they'd like to. So that's my foundation of my practice. Then I also refer like crazy to functional medicine doctors, expert referrals in any number of fields, love adjunctive technologies, and of course hyperbaric therapy too. But not right away all the time, and not always. And I think that's important. I love hyperbaric therapy. I think it's a phenomenal technology, but it's not for everybody, and it's not always the right time to use it. And this is Dr. Ted Achacoso, and this is health optimization in practice. Just to give you a sense of what we're doing, we're really looking at the metabolome. Has anybody heard of the metabolome before? Metabolome is all the metabolites that our cellular processes make. So vitamins, minerals, cofactors, antioxidants, looking at toxin metabolites, looking at gut metabolites, and all these other aspects are part of it. But what I realized is that if your energy supply is in the tank, right? If you have your B vitamins in the tank, your antioxidants are in the tank, you have toxins all over the place. If I put somebody in the chamber, they're not going to do well because they don't have any machinery to actually build on the oxygen that I'm giving them. Because maybe what I didn't make clear in the beginning is that what is oxygen doing? It's creating energy at the cellular level. It's causing the mitochondria to produce energy. But if you don't have the cellular processes in place, I think it's not going to work all that well. And that's been my experience. And so I always start with this, at least when I can. And then just to give a couple examples of some systems that I work with, neurologic conditions. So stroke, traumatic brain injury, Alzheimer's, and Parkinson's. I have a wonderful story, and this is somebody that is a beautiful example of an integrated practice. His name's Sean Dollar. Sean's a surfer. Sean broke his neck. I think he's surfed like the biggest waves in the world, and he broke his neck surfing, had a bad traumatic brain injury. His neck healed. His neck bones healed, but he was left with a bad brain injury. He couldn't think. He couldn't do his job. He couldn't take care of his family or even be a dad. He went to the Amen Clinic, which is a place where they have some work and do some imaging of the brain. They saw the traumatic brain injury. He got hyperbaric therapy. He got about 80% better. And he got neurofeedback, maybe 5% better. He got hormonal treatment. So he got blood treatment he got his hormones tested, and he got hormone management. He got another 10% better, maybe 5% better. And then he got stem cells intravenously, and he got 100% better. So he went through the process, and we integrated lots of different things together to get him better. And now he's fully back, 100%. And examples like that are just what I see most often. I see if somebody just does one thing, they're going to get only so much better. There are exceptions, and I think Dr. Adelson made some really good comments about, I believe truly in musculoskeletal types of interventions and very local therapies can do that. But systemically, if you have systemic issues, these do take an integrative approach. And this is my approach for neurologic conditions, looking at health optimization medicine in practice, functional medicine, looking at expert referrals. Some of you are probably in the audience. Technologies, low-level light therapy, neurofeedback, pulsed electromagnetic field technology, and of course, hyperbaric therapy as well. How much time do I have? Okay, so I want to talk a little bit about stroke, but I'm not going to get too crazy about it. But basically just to say that we know hyperbaric therapy can heal patients that have had strokes. I like this example. I'm just going to give it. So if you can imagine a lake that's still, no water moving, you throw a rock in it, there's a direct impact of that rock in the lake, and there's ripples around it. The ripples are much larger in surface area than the actual direct impact. So if you can imagine, if somebody's had a stroke, the direct impact can be large, but the ripples around it are still going to be larger, okay? So what hyperbaric therapy is doing is actually oxygenating the area that's not dead. All those ripples around the area. So the periischemic area, the ischemic penumbra, all these medical words, but that's where hyperbaric therapy can work in the acute setting. And in the long-term way, it can actually rebuild some of that scaffolding that may have been damaged. These are some of the studies that have been done recently on stroke, both acute and long-term. Just want to make a mention of cancer and hyperbaric therapy. There's a lot of synergistic approaches now. You're looking at cancer and hyperbaric therapy together. There is no indication that hyperbaric therapy has any pro-growth on cancer. So cancer won't get worse in a chamber. There is some worry about that, but there's several studies that have been done that show that that isn't the case. We use hyperbaric therapy in cancer in multiple ways. Some of these, well, the first way I already spoke about. There's a lot of interest in the ketogenic diet and hyperbaric oxygen therapy for cancer. And also, it does seem to have a sensitivity effect, so improving chemosensitivity and radiation sensitivity as well. So lots of interesting work being done. Hyperbaric therapy on its own is not a treatment for cancer. I'll make that clear, but it can be synergistic and help. And then my approach for cancer is similar to the way it is for traumatic brain injury or a neurologic condition. You want that foundation. Again, if you don't have that foundation, the rest of the stuff is going to break down. It's plain and simple. And you may at least not get the optimal results that you would get if you had that foundation first. Lots of cool things that we're doing, ketogenic diets, antioxidant overdrive, and all this fun stuff that we could talk about another time or if you have interest. Stem cells, so we know hyperbaric therapy has that releases stem cells from the bone marrow exponentially. It does that also from the brain as well. These are some of the studies that have been done to show that. And also it's being combined with PRP. We heard about PRP earlier. PRP is all the growth factors. What hyperbaric therapy is going to do is going to actually release the stem cells from the body, go to those areas of inflammation, helping those growth factors. So you combine that with localized treatment, which is what I do actually, with a local colleague, and we have fantastic results. Hyperbaric therapy and performance. That's me on a VO2 max bike. That's as much skin as I'm going to show you, I promise. Right. But we know that hyperbaric therapy is regrowing blood vessels around the heart. So you're going to increase oxygen carrying capacity by having more blood vessels around the heart to pump that muscle while you're working out. We know it's going to improve cognitive ability as well because you're going to be growing new blood vessels in areas of the brain that store memory, like the hippocampus and like the frontal lobe. And we know that's going to help with sports injury recovery as well. So I put performance in quotes because this is a penis, and we know hyperbaric therapy can also improve penile blood flow. And there's a recent study that was done on angiogenesis and recovery of erectile function. There's some stem cell procedures that are being done for that as well. It's a very safe technology. I often say hyperbaric therapy is safer than a Tylenol. It really is. However, if you have a lot of ongoing oxidative stress, if you have a lot of inflammatory burden in your body, you want to think about getting some of that stuff tested like I talked about. You want to know what you're starting with so you know how to replete and to make sure that you can optimize your protocol. So the other thing hyperbaric therapy does is stimulate all those antioxidant pathways at the same time. So that's a good thing, but if you have a lot of oxidative stress ongoing beforehand, it's something to take into consideration. So I will consider sometimes targeted antioxidant support. Some of the side effects, they're very rare. The biggest one is that if you've ever been on a plane or a train, you'll get that ear pressure sensation change. And for the most part, it's not a problem for people, but we can, if it is, we can give little tricks of the trade to make it easier. So some of these other things are very rare. What I would say is that hyperbaric oxygen therapy is classified as a drug, so it does require a prescription. Some people would disagree. It's just oxygen, right? That's what we're breathing now. I have a mixed opinion, I would say, because I feel that I think most of the people that are going into a chamber should know why they're going in, not just go in because somebody has one at their home. So in my opinion, I think it's relatively good that it's regulated, but I do think that try not to get too conspiratorial here, right? But hyperbaric oxygen therapy can't be patented, okay? It's a drug, but I can't patent this drug. As a result of that, I can't compete against the stroke drugs or the heart drugs or the blood vessel drugs because I don't have the money to do the studies. So there's that. Yeah. So contraindications, very few, but in the end, the only one you can't go in the chamber with is if you have a dropped lung, if you have an untreated pneumothorax, if you have COPD, if you have a bad heart. All these things are actually doable if they're done under supervision, but overall, these are what we see here. So this is my second to last slide. And how many, I think I've shown it twice so far. This is really what I want you to take away from today. So hyperbaric therapy heals wounds from the inside out. It's really that simple. And it does it by reversing hypoxia, or low oxygen, decreasing inflammation, fighting infection, and causing an exponential release of our own stem cells from our bones and from our brain. But really a foundation for all of us is key. And integration of various technologies and other practices can really be helpful as well. But that foundation is really, really important to optimize us all, whether you go into a hyperbaric chamber or not, as far as I'm concerned. So, I'll leave with you with a quote, or a couple quotes here. Albert Einstein once said that imagination is more important than knowledge. My colleague and mentor, curiosity is more important than imagination. Think about that, right? But without oxygen, it doesn't matter, does it, right? So, all right, okay. All right, thank you very much. I don't have a picture of my kids. I should have one here.
Yeah, okay. Questions for Dr. Sherr?
All four of them.
So I have a 6-year-old son who has autism. So I was wondering, like, does hyperbolic treatment helps in that?
So the question about hyperbaric oxygen therapy for autistic spectrum disorder. So the real answer is that it can, but it may not, depending on the person, depending on the individual. I don't often recommend hyperbaric therapy on its own for patients that have, or that are on the spectrum. It takes an integrative approach. It takes looking at, what is the foundation that this child needs or this adult needs to help them be at their best capacity. So looking at the things that I mentioned and having an expert on autism, like somebody that's in the functional medicine world, that's been my best experience. So if somebody came to my office and said, my son, my daughter has autism, can I put them in the chamber? I would go, my first question is, are you working with somebody that specializes in autistic spectrum disorder from a functional perspective? If they say yes, then I go, okay, we're in business. Okay. But if they say no, I say, let's find you somebody to work with first. Because I mentioned that hyperbaric therapy is covered by insurance for some indications, but it's not for others. So it's important that for those that are not, it's going to be an out-of-pocket cost, that we optimize your son's time in the chamber, for example, if we were going to do it.
So, yeah, we are seeing multiple doctors,
Yeah,
neurologists,
I would imagine if you're here.
autism specialists and everything. So you also mentioned that you go through some tests to see whether it will work for him or not, right? So suppose I'm coming to you, should I bring those reports or like how?
Oh, I see. No, so what I would say is that combining the functional medicine approach with hyperbaric therapy can be very effective, because what hyperbaric therapy potentially can do is help with the blood regulation to the brain, help just kind of recalibrate the system a little bit, is what we think it does. Getting that foundation done first, knowing that you've gone through the process of balancing, of making sure his gut is okay, making sure he's off the right foods, making sure that he's doing better already, makes him at a better chance of getting better in the chamber, is what I mean. So I don't necessarily need to see the labs themselves. There's no way to know after 1 or 2 treatments if he's going to get better in the chamber, for example. It's usually a protocol that is required for us to see any benefits. So sometimes in some patients we can see after 1 or 2 or 3 treatments, we can see a significant effect. But that's rare. Usually it's going to be more of a protocol like we spoke about.
It's last question, sorry. How much pressure you use for a 6-year-old?
For 6-year-olds, we are not using a whole lot of pressure, somewhere between 1.3 atmospheres and 1.75, but usually not that high. 1.5 is average.
I'm just curious, there's kind of an epidemic of high blood pressure. What's the relationship between the hyperbaric and then blood pressure?
So hyperbaric therapy is going to cause a little bit of constriction of the blood vessels. So it's actually going to increase the blood pressure in the short term for about the time of treatment, about 10 points on the systolic scale. We don't have any indication that it increases blood pressure over the long term. We don't have any indication that it decreases blood pressure over the long term. We do know that actually it improves insulin sensitivity. So so for example, if you're a diabetic, you will need less insulin in the chamber. So we have to be aware of that. There's some indication that might be one of the reasons why people actually improve more on the acute setting when they get hyperbaric therapy. So if you've had a stroke or a heart attack, your blood glucose is more regulated in the chamber, that may help you recover faster and actually more completely. So interestingly.
I've got a two-part question for you.
Yeah.
The first part is, what would be a protocol for, say, chronic fatigue syndrome look like? And the second part is, I looked around for hyperbaric therapy before, and I called many different places, and I got a wildly different price estimate. So if you could give us any guidance in terms of what's sensible pricing for a session, that'd be helpful as well.
Yeah, no, those are good questions. So chronic fatigue syndrome. I'm going to be a broken record, right? But it's really important to have that foundational approach first. I've had a lot of great experiences with patients getting in the chamber and doing well with chronic fatigue, but I've also had some experiences, the latter, actually bad experiences, where people get worse in the chamber because of all the oxidative stress, all the inflammation, and if you haven't worked on some of that foundational stuff first, they have not improved. In fact, they've gotten a little bit worse. They usually get back to where they were. But so the key for me is to understand why somebody has chronic fatigue, if it's possible to find out why. And I'm very much understanding that we don't always find out why. But I have had success. The protocols look like 30 to 40 treatments typically, typically sometimes more, depending on how people are doing. And they're done successive days, Monday through Friday, with the weekends off. And what happens often with chronic fatigue syndrome is you tend to have people get worse before they get better sometimes as well. But sometimes they'll get a little worse, and then their body will have this upregulation of some of that antioxidant stuff that I talked about, and then they start getting better, they start detoxing, they start improving. Maybe it was Lyme they didn't know about. All of a sudden their Lyme test is positive. Maybe it's some other bacteria or parasite or something that's come out now, and we have seen that, so all of a sudden something manifests throughout the treatment process. As far as cost goes, it depends on the type of treatment you're getting. If it's a soft hyperbaric chamber, a mild hyperbaric chamber, those are typically less money per treatment. The hard chambers in the Bay Area, it could depend, but it's somewhere between like in the high 2s to low 4s for per treatment. We're talking out of pocket. So, but if you go other
Hundreds
places
or
around the
thousands?
country, what?
Hundreds?
High
Thousands?
200s.
Hundreds. Okay,
yeah,
good.
Sorry. Yeah, good point. Yeah, high 200s to high 400s or mid 400s for pricing. So, and that's the going rate in the Bay Area. In other places around the country, it'll be less money. It's the Bay. You guys know that. It's unfortunately the way things are. One thing I want to mention about soft chambers, though, because there's a lot of excitement about you can get these soft chambers in your house. It can do some of the stuff that I talked about. I don't ever recommend soft chambers for anybody that has any open wounds, that has any ongoing infections, that has any chemical sensitivities, or somebody that has a lot of systemic inflammation, like chronic fatigue, for example, because I haven't had a lot of success with those chambers. I don't think it's enough pressure. I don't think it's enough oxygen. But for neurologic conditions, there may be a role.
So,
sorry, I just wanted to make that clear.
Does deep breathing or exercise have any of the benefits, something like that?
So interestingly, we're having more patients, the biohacker type, come in and do deep breathing, other breath sort of work and see if they can increase their lung capacity. And there's some indication, I mean, I don't have any evidence to show this, but it seems like it could be more effective, more oxygenation as a result of some deep breathing techniques. I don't ever recommend holding your breath in the chamber. That's something I don't recommend. But people who do more recruitment of lung, it would make sense, right? You have more oxygenation, more surface area, getting more oxygen in the body. There's some people that would say you may be able to get the same effect at less deep pressures, for example, to be able to do that. We don't have any evidence yet. There are other technologies, the one's called exercise with oxygen therapy, that you can actually ride on a bike breathing 100% oxygen. And there's all these other technologies that are around that are interesting, that are looking at ways of pairing more oxygen with exercise.
Exactly. I want to ask you why we need the higher pressure of oxygen. Why we cannot just have the oxygen?
Yeah, that's a great question, and thank you for asking. The pressure is what's required to get the oxygen into the body at the level that we're talking about. You can only get oxygen on the red blood cell if you don't have the pressure. But if you have the pressure, you get it into the liquid of your blood, the plasma of your blood. And that's where the effect of hyperbaric therapy is so powerful, because you only can get it so much into the red blood cell, because all those sites are almost all saturated in all of us right now. But the plasma has very little oxygen in it. once you saturate the plasma, that's the power of hyperbaric therapy.
Hyperbaric oxygen treatment do anything for Alzheimer's or Parkinson's?
So these are big topics, Alzheimer's and Parkinson's. What I can say is there's been studies that looked at neuroinflammation. So the idea that hyperbaric therapy can depress the whole inflammatory cascade. So it's not going to be a direct treatment for Alzheimer's, potentially, but it can be used synergistically to help with the inflammatory cascade going down as the body potentially is being healed in other ways, depending on what you think of and what you believe is possible in Alzheimer's, of course, right? So there's lots of interesting work that's being done. I think Dale's been here before. Dale Bredesen has spoken about some of his protocols, which are amazing, looking at all these different types of Alzheimer's disease, if it's toxic, if it's infectious, if it's genetic, or if it's related to insulin resistance. And so in any case, I think hyperbaric therapy can be used in all of those categories just to help with inflammation and help with detoxification. The pressure, by the way, not just helping with oxygen get in, but also helping with lymphatic flow, so helping with detoxification at the same time. So as a synergistic approach, absolutely. Yeah. Parkinson's, the same thing.
What kind of a detox process would you recommend before trying out any of this?
Big questions. Okay. What detoxification would I recommend? It really depends on the person. It depends on why they're getting into the chamber, depending on what their protocol is. If it's 3 treatments to heal their facelift faster, which we get, it's not going to be a huge amount of detoxification that's necessary. If it's somebody that comes in with Lyme disease for 30 years, then I want them to see somebody who knows a lot about Lyme disease, much more than me, and I want to think about all that inflammation that I'm going to cause by killing all those bugs, or helping to kill all those bugs. And so then you have to think about various ways of doing that. I mean, the spectrum is huge. And so, I mean, the exact protocols depend on the person, so they can vary widely. I don't know if you want to give specifics, or you're looking at, I mean, you're really looking at gut specific, and making sure you're healing your gut, or making sure you're detoxifying your gut. You want to make sure your immune system's working well, make sure your antioxidant levels are at good capacity. You can do tests to look at that, and I try to do that beforehand as well. So, and supplementing is needed.
Oh, since I'm right here.
Are there any studies which measured increased or decreased detoxification out of the body, all bad stuff like heavy metals, maybe PCB, some other chemicals, glyphosate, anything else?
Glyphosate, is that what you said?
Yeah.
Yeah, I'm waiting for those studies too, because we're seeing it clinically. Because we're seeing it when patients are getting treated for heavy metal toxicity. If you use hyperbaric therapy at the same time, they do much better, at least anecdotally in my experience, but we don't have any studies to show that yet. What I think is happening is that when you're leaching those metals from tissue, you're causing, again, the inflammatory response. And what is hyperbaric therapy doing? I said it a billion times, it's decreasing inflammation. And so I think helping just maintain and just sort of make sure that inflammatory response doesn't get out of control. So
if you're increasing glutathione, if I recall, if I'm not mixing
Yeah.
tox,
Yeah.
then that would also help your
you're
toxic
increasing the
metal
antioxidant
status, 'cause
pathways as
your
well. Yeah.
antioxidant pathways would
Yeah,
take
your
care of
NRF2 and yes, and your superoxide. Yes.
it. All right. Sorry, so
You mentioned that for radiation that it can be helpful, right?
Yes.
Hyperbarics. So a 2-part question. I mean, my daughter had thyroid cancer and she had radiation. And how would she go? So one, how does it help
Sure.
that specifically? And secondly, how would I go about getting her a recommendation?
Sure. So radiation, what it does to tissue, as it basically depletes it of stem cells, it depletes it of blood vessels, and causes fibrotic changes or scarring to the tissue. What hyperbaric therapy is going to do is make new blood vessels, bring new stem cells to the area, and decrease the amount of fibrosis in the area, the amount of scarring. So that's really what it's doing. And that's the physiology of it. And we're seeing it, we see it in real time. We see it in patients. I've seen it in patients as young as 12 or 13 years old that got radiation a couple years ago to patients that got radiation 30 years ago and just started having symptoms, because radiation's a tricky thing. You may not have symptoms right away, but you may have symptoms 30 years from now. Especially head and neck cancers that get radiation, they take out a tooth 30 years later, all of a sudden their jaw starts to die. So hyperbaric therapy can potentially heal that or mitigate it or potentially reverse it. So as far as a recommendation, there's a couple ways to do it. You can potentially see if she still sees a radiation oncologist or an oncologist, they could give her a recommendation. You could bring her to one of the clinics around the area, one of the freestanding clinics, or one of the hospitals even would be able to do it. Yeah.
Okay, great.
Yeah,
So
maybe. If you have any trouble, you can call me. Yeah.
we'll get down to like the last couple of questions, if we would, and then any further questions, Dr. Sherr will be available after for to talk to people.
Yes.
So
Thank you.
I think I went right by here.
What's the difference between this kind of oxidative therapy and ozone therapy?
Also a good question. So I'm not an ozone expert, but I do believe that ozone likely has a place in a lot of the work that I'm doing. Ozone is O3, and it's injected either in the IV into the blood or into joints. Sometimes it's used with injections like prolotherapy, et cetera. Hyperbaric therapy is a different technology. We just talked about that. There is some crossover. It's a funny story, right? The ozone guys think everything can be cured by ozone. The hyperbaric guys think everything can be cured by hyperbaric therapy, right? This is classic medicine, right? Cardiologists think everything, et cetera, down the line. So my opinion is that they actually work very well synergistically in some cases. In some cases, ozone's better. In some cases, hyperbaric therapy is likely better. So I think it's a bit of a spectrum. I think ozone is really good for infection, for example. So I've had a lot of good experience with patients actually combining intravenous ozone with hyperbaric oxygen therapy, and even rectal ozone, actually, for things like Lyme disease, for example. So I'm not a purist. I think you probably could tell that. I like hyperbaric therapy. I think it's fantastic. But if ozone's also going to be helpful, I want them to see an ozone doc. And there's one in the city. There's one up in Santa Rosa. I'm sure maybe some of you know who that is. And I recommend them. I will, if I do believe that it'll help. So I hope that helps.
So this question might not be totally on point, but we've talked about oxygen so much tonight.
Yeah.
I have sleep apnea and have had it for 20 years. I've slept with a CPAP machine all 8 hours for 20 years. Am I getting more or less oxygen because of that?
You're getting a ton more oxygen because of that. Yeah, because if you weren't wearing CPAP, your airway would be closed and you would stop breathing and you'd get less oxygen.
Yeah.
So one of the first questions I ask people, and I recommend you do this to your family members actually, is if they're having trouble remembering stuff, ask them if they snore. Because a very simple way to regenerate that is just get them a CPAP if they need it.
You won't snore when you're wearing a CPAP.
Well, if it's something else, it'll be louder than the snoring anyway, won't it? Yeah. But I've had this experience. Yeah, so patients with brain injuries that don't get better, patients with strokes that got a little bit better but didn't get all the way better, patients just have mild cognitive impairment. I have young people that are 40 years old and they can't remember their birth date, but then they get a CPAP. So that's the first thing. Like, if I put them in the chamber, it's going to help for a little while because they're going to get oxygen. But if I don't ask that question, then I'm not going to help them in the long term. So that's a big deal. So that's why this integrative approach is so important, and the collaborative approach. So I say, okay, you need to get a sleep test, go see my friend that works at this pulmonary clinic, and then if you have sleep apnea, work on that first. Hyperbaric therapy is going to help, but it won't help in the long term if you don't.
So what I'm hearing you saying, if you get more oxygen in your body, that could be an anti-aging advantage? Because I'm 82 and most people guess I'm 62.
Yeah, whatever you're doing. Maybe it's CPAP, I don't know.
I'm wondering if it's more oxygen.
Well, so the program in Israel that I mentioned, 20,000 person waiting list, 200 patients a day, 85% of those patients are on their anti-aging program. All this basic physiology that I talked about, decreasing inflammation, new blood vessels, fighting bugs, stem cells, they're actually showing this in clinical studies and then taking regular people that are just getting older and putting them through hyperbaric chamber treatment, looking at diagnostics before, diagnostics afterwards. Some of them I didn't have time to show today, but you can see their brains regenerate. You can see their hearts regenerate. You can see their penises regenerate, right? So it's an anti-aging technology because we're really healing wounds, right? And no matter what those wounds are from. So you're going to see a lot more about hyperbaric therapy in the future as this anti-aging technology. But really what it is it's just this physiology, and that's why anybody can benefit from it. But if you want to benefit optimally from it, understand why you're getting in the chamber, optimize the money you're spending, have a foundation, and go from there.
Okay, great. Thank you, Dr. Scott.
Oh, my
Sherr.
pleasure.
One more time.
Thank you. All right.
All right. Thank you for coming tonight. Our next meeting will be September 20th. I believe that's the third Thursday of the next month, 7 p.m. I hope to see you all then. Thank you. Good night.